Hey girls, so it is time for my week 37 pregnancy vlog. It is Friday and I'm actually 37 weeks and 6 days. So I know these vlogs keep getting later and later, but I'm not going to miss a week. So yeah, so I'm feeling pretty good since I left you with the vlog last week. Um, on Friday, last Friday, I had I was supposed to have my meeting with my doula, but she had a patient go into labor. So Monday night, she wound up coming over, and we just spent like an hour or so talking about kind of how I cope with stress and how I like to manage pain and what I do to get away from all of the stress and things like that. She also taught my husband how to like push on my hips to kind of help with some hip pain that I've been having, and so kind of just some techniques to help me feel more comfortable. So then on Tuesday of this week, I had my OB appointment and found out I am group beta strep negative, so that's good. Um, what that means is I don't need to be on antibiotics when I'm in labor, so I don't need to be hooked up to an IV. Once I'm in the hospital, I'll have an IV port, like a lock, but I don't need to be hooked up to any medication. Um, and also, according to my OB, it's still fine for me to labor in water and take a bath after my water breaks. She said if I was GBS positive, that she wouldn't want me to do that, but since I'm GBS negative, it should be fine. So that is exciting. I was GBS negative with my son as well, so good to know I still am. So I actually lost like a pound or two this week. I don't know if you remember last week's vlog, I had gained like 5 pounds or so because my appointment was right after I got off work and I was all swollen. So this week, my appointment wasn't until the next day after I got off work and the swelling had gone down. So I lost some of that weight. So that's good. And I'm slightly over 1 centimeter dilated still and just softening, but not any percentage that she would give me for effaced. She said the baby did drop, which I think the baby for sure dropped by I think it was like Friday night or Saturday, because I started getting the oh so familiar tailbone pain where the baby is laying on my tailbone. I've been contracting all week. Sometimes they get down to like every 8 minutes or so, and they're lasting. I have all different kinds of contractions. Some of them are the ones that last for 2 minutes. I've had ones that last for 5 minutes. But the ones that actually are painful and that are probably productive are the ones that only are lasting for about 30 seconds to a minute. And they kind of start lower and then move up, where the other ones, it kind of just, my whole belly gets hard. And sometimes they start in my back, so I have a variety of contractions. My doula said I should know I'm in labor when the contractions are shorter. Like the Braxton Hicks can be longer, but when you're actually in labor, they shouldn't be that long. They should be, 30 seconds, a minute, coming regularly, and the interval between them should get shorter and the contractions should get longer over time. So, yeah, but my doula is officially on call for me. She has been since I'm 37 weeks if I would go into labor. So, I really didn't want to go into labor. Today is 11/11/11. I heard the hospitals are just going to be a mess with inductions and C-sections and people who try to induce at home for today. And on my baby center board, women who are in the hospital right now. I saw one lady say she was the only one in the hospital, but most of the women were like, it's crazy. They came and took the bed out of their room, like the support person, like cot that they can sleep on or whatever is in that hospital. They were like taking them from rooms where there wasn't anybody staying with the mom, and I don't know, sounds crazy. So I'd like to let all those women get discharged before I would have the baby, but she can come anytime. Yeah, I don't know how much longer I will be pregnant, because I've heard once the baby drops in a second pregnancy that labor is not too far around the corner. So, yep. That being said, I'm still planning on working this weekend, so we'll see how that goes. Last weekend when I worked, I did okay until like the end of my last shift that I worked, and I was running around getting patients out of bed and home, and I started having frequent contractions, and they were not painful, but like my stomach was so hard I was useless. Like I couldn't um, walk around and bend and pick things up like I normally need to. I had to like stop, let the contraction pass, and then keep on doing what I was doing. So just being on my feet has been inducing some contractions, but for the most part, I can still do my job. I just have to know when to slow down. So, um, and this week, I would say like one of the symptoms that I definitely have been having is nesting. Um, I, it might be because I'm not sleeping very well. Like I can sleep for about 4 hours or so, and then my hips really start hurting. I just get like achy, like kind of like a toothache. Like it just doesn't stop. It's not like a sharp pain or anything, but like just laying on my side, my hips just hurt, and I can't lay on my back because my belly puts so much weight on my back. It hurts my back, and I start having contractions and around ligament pain. So I have to be on my sides, and my hips can only take like maybe like 4 hours of sleep. So I get like 4 hours of sleep at night. And then I get up with Connor when he gets up, and he's been getting up at 7 because of the time change. He's not adjusted yet, so we get up early, and then when he naps, I nap, and I usually get about 3 hours of sleep during the day. So 4 hours at night, 3 hours during the day. And I'm a shift worker who like regularly switches from days to nights, and so I'm kind of used to like having a messed up sleep schedule, so it's working. I'm still getting 7 to 8 hours of sleep a day, just not all at once, which is fine because that's how it will be when the baby is here too. I'm not going to get consolidated sleep anyways. So, but anyways, with that sleep schedule, I've not been tired at my bedtime. You know, normally I was going to bed at like sometimes as early as 8 when Connor went to bed. But the latest I would be able to stay up is like 11, and then I would just be like so tired. And I'm just not getting tired until like 3 in the morning or so. And I don't, I'm definitely nesting. I don't know if I'm not getting tired because I feel like I need to get things done, or because I'm sleeping some during the day. I don't know. But regardless, my body wakes me up after 3 or 4 hours, so it's not like I'm doing any harm by breaking my sleep up like that. But I've been like doing like organizing things and cleaning things, and like the other day I organized our laundry room, and I lined the shelves, and I organized all our cleaning products because we keep all the cleaning products in our laundry room, like up on a shelf where Connor can't get to anything, so we don't have anything under the sink or anything in the kitchen. So I organized all that, and I took everything out of our fridge, and I cleaned the shelves, and put everything back. Like I took the shelves out of the fridge and cleaned them and put them back, and I stripped all the cloth diapers, and so I prepped all the pre-folds again. So I don't know, just like these stupid things that don't really need done, but I just have to do them and I have to get them done. And I organized like all the drawers in our kitchen, and like it's ridiculous, because no one needs to be wasting time doing stuff like that. But when our house was functioning just fine before I organized everything. But so lots of nesting, and then it was like I was nesting like that for like 2 nights in a row, and then on the 10th there was a full moon, and I was like, this is crazy. But I didn't go into labor during the full moon, so I guess that's good. It was just one of those weekends. Maybe I'll get some rest this week. We'll see. I'm seeing the chiropractor today. I figured since I was in that little accident with the deer on Halloween, and I should be seeing the chiropractor just because I should go once a month. I just scheduled an appointment to go get adjusted today, just in case that little bump into my car, I don't know, messed with my alignment at all. I don't think it did because like the car didn't really move, but you never know. Yeah, and as far as like anything, I'm trying to get labor started. I'm not doing a whole lot. I'm taking 6 capsules of red raspberry leaf tea, and that is not for induction. It just helps tone the uterus so that when you do go into labor, your contractions are more productive. They actually help dilate you and efface you more efficiently. It's kind of like lifting weights. Like it just gets the muscles that are needed in labor ready. So 6 capsules is the ones I take. That's equal to 3 cups of red raspberry leaf. I don't think I can swallow 8 capsules a day on top of everything else that I take every day. So I'm taking 6 of those a day, 2 at a time, like morning, noon, and evening. And then I'm taking evening primrose oil. I started that this week, just orally, and I'm taking 1,500 milligrams in the morning and 1,500 milligrams at night. Yeah, so that's pretty much it. I just am taking the evening primrose oil. It's a prostaglandin, and it'll help soften the cervix and things like that. So yeah, that's what I have been up to. Okay, I'm going to go ahead and show you the belly, and I think that will be it for this week. All right, so here's the belly. It's kind of hard to see. And you can see I've got some stretch marks right here. Those are new ones, and then those are old ones, but they're darkening a little. But these are definitely Annabelle stretch marks. And from the front, and the top of my uterus is right there now. So, and she is, I don't know, I'm having a contraction now, so I can't really feel. And there's from the other side. So this might be my last belly shot. Who knows? There's my little baby girl. Yeah, her bum is like all the way down here now. So she's all like in this area now. So that is it for this week's update. But like I said, you may hear from me in the next few days, just depending on what happens, because it's getting to be that time. So thanks for watching. I'll talk to you later, girls. Bye.